This is Democracy Now! As we continue our coverage of the World Trade Organization and the fight over intellectual property rights during the pandemic. We're joined by the acclaimed Filipino scholar and activist Walden Bello, the co-founder of Focus on the Global South. He's an adjunct professor at Binghamton University and a former member of the House of Representatives of the Philippines. His new op-ed in the New York Times is headlined, "The West has been hoarding more than vaccines." Walden Bello, thanks for joining us again from Manila. Welcome back to Democracy Now! Why don't you start off by talking about the significance of these meetings and what difference it would make for people in the Philippines and in Asia overall, in the Global South for that matter?
Well, as you know, because of the shortage of vaccines, we are in a situation where about 0.2 or 0.3% of the population of the Global South has had access to vaccines. And here, for instance, in the Philippines, it's only been around 260,000 people, or 0.025 of the population of 110 million people who have had access to vaccines. And, there's no certainty about when these vaccines will arrive. We have mainly gotten a few shipments from AstraZeneca, a significant number of donations from China, and just the last 2 days, the Sputnik V or Sputnik 5 from Russia arrived. But with respect to the Western vaccines, there's a very great deal of uncertainty when those would in fact be coming, because of the fact, that a lot of vaccines that should have been going to the South have been hoarded by the European Union and by the United States. If the press officer or of the Biden administration, Ms. Psaki, has in fact said that our policy is to be oversupplied. And one of the things that the Biden administration did in response to the situation in India was to say it was going to be sending about 60 million doses of AstraZeneca. And it was found out in a report in the New York Times that those are potentially spoiled vaccines that were produced by this factory in Maryland that had been contaminated.
That also produced the Johnson & Johnson vaccine that led to a halt on the Johnson & Johnson vaccine. That Johnson & Johnson AstraZeneca somehow contaminated each other at this factory.
Right.
Yeah.
Right. And, when people heard that, my God, they're sending spoiled vaccines to India. And that was taken as sort of, well, let's send the spoiled stuff to the Global South, and we're going to keep the good stuff, here in the United States. So that's been sort of the mixed messaging that has been taking place with the rhetoric of the Biden administration. I think it is going to be very important what happens in Geneva over the next 2 days. As Lori Wallach says, the decision point is, will the U.S. stop blocking negotiations, okay, or will it continue Trump's policy? And, this is the inflection point for the Biden administration with respect to the Global South. If it fails this one, there's just going to be tremendous distrust of U.S. foreign policy initiatives. So the test for Biden and, for the Global South has come very early. But then you don't choose the time when these things, come on. And as far as I know at this point, it's We don't know exactly what is the thinking of the administration going into Geneva, and it's kept its cards very close to its vest. And but as I said in my column, in my guest editorial in the New York Times, Mr. Biden, knows, what is the right thing to do, and the question is, will he have the courage to do the right thing?
Walden Bello, have you gotten a vaccine?
Yes, I have. As a senior, I was a priority. It's called Aid 2. And we were given the first dose of the vaccine. Okay, so seniors in my city got the first dose of the vaccine. But the vast numbers of people, aside from seniors and from healthcare workers, frontline workers, have not gotten the vaccine yet. So, and will we get the second dose? We don't know. It all depends again on developments in India and developments in different parts of the world. Now, we would not have been facing this supply problem if when the India and South Africa had proposed the waiver the first time around, October of last year, and the U.S. and the rich countries, the other rich countries, hadn't blocked it, we could have moved already to be able to, get the formulas for the vaccine, the technologies to bring them out, repurposing, as Laurie said, the big pharmaceutical capacities of a number of different countries in the global south, like South Africa, India, Thailand. So that could have already begun. But here then is the tragedy that, we lost all that time. We lost about 6 months because the U.S. was just not cooperating. It just was so short-sighted, and it was caving in all the time to the pharmaceutical companies who are tremendously unpopular in the global south, but also in the United States, because these companies are just raking it. As we heard earlier, the billions that Pfizer is making, it's mainly out of the biggest moneymaker has been the Pfizer vaccine over the last several months. So it's this very, very big contrast between what are the needs of humanity and what are the needs of these people in the drug industry, which not only are they making tremendous profits for their shareholders, but we're talking about executives that head these people, these corporations, making tremendous amounts, in terms of their salaries, ranging from around 15 million to 25 million a year. These are the people, basically, among the 1% who are making these decisions to block what would be benefits for the global poor, which is to live, allow them to live. So this is really, if I may put it this way, this shows, the tremendous, irrationality of global capitalism, where profits for a few takes precedence over the lives of many. This is why my sense is that the dynamics of this period of the pandemic has really exposed why we need to overcome capitalism to get out of this system that allows these decisions to be made by a few, creates tremendous inequalities, and allows a lot of people to die because the medicines or the vaccines that would allow them to live are being blocked.
So I want to talk about the Philippines. We've heard a lot about India, which we cannot hear enough about. They are going through a COVID tsunami. The Philippines has recorded over 1 million COVID cases and at least 17,500 deaths, the single highest in Southeast Asia next to Indonesia, the second highest. Many hospitals are struggling to handle the latest surge in cases. I want to turn to a doctor in Manila.
The hospital at the NCR, especially the government hospitals, they are now struggling. We noted an increase in the number of cases, just as we noted increase in the number of health workers being positive, no, in the past, especially in the past since March.
So if you could talk about the crisis in the Philippines and Asia, but also a poll has just come out that was done in some 53 countries. And it says the U.S. is seen around the world now as more of a threat to democracy than Russia or China. And this goes to the difference between how Russia and China is dealing with the rest of the world and these vaccines and other technologies, medical treatments, and what the U.S. is seen as around the world.
Yes. Well, over here in the Philippines and in a number of other Southeast Asian countries like Cambodia and Thailand, there has been this second wave that has been occurring since early March. And the second wave has been more devastating than the first wave in 2020. In the Philippines, they've been, for a couple of weeks, records of infections were being broken almost every day. Within the last week, for instance, the infections have ranged from around 7,000 to 9,000 people being infected every day, and so we have a situation which is pretty bad in terms of hospital space having run out. People, especially about 2 weeks ago, they've had to keep, people in tents outside the hospitals. Some of them were even just in their cars. There have been incidents of people who couldn't get into the hospital and just died in their car. And then, like we've heard in India, there's been a shortage of oxygen. And stores running out of oxygen tanks, and basically, something, it's not as bad as what's happening in India, but certainly it was pretty rough, and people were just not prepared for this situation. Now, several factors really come into play here. One, of course, is the glitch in the vaccination program, mainly because the supplies aren't coming in because of the hoarding by the Western countries. The second, thing has been, to some extent, a sort of becoming a bit complacent, in terms of social distancing and a number of other very important measures like, face masks being worn properly. But I think a big factor, and I think this is the central factor, is that the government has just been so inefficient and incompetent in dealing with this situation.
So you had President Duterte first saying he's not going to take the vaccine. That enraged public health officials. Now he's taken the Chinese vaccine. And Walden Bello, I wanted to ask you about China and U.S.-China relations in light of all of this. On Tuesday, foreign ministers from G7 nations met in London. They're continuing to meet. China topped the agenda. This comes as both China and the United States are accusing each other of escalating tensions tensions in the South China Sea. Last week, the Chinese government claimed there's been a 40% increase of activity by U.S. planes in Chinese-claimed areas since Biden took office. Activity of U.S. military ships is up 20%. On Sunday, Secretary of State Tony Blinken appeared on 60 Minutes and accused China of acting in increasingly adversarial ways.
It is the one country in the world that has the military, economic, diplomatic capacity to undermine or challenge the rules-based order that we care so much about and are determined to defend. But I want to be very clear about something, and this is important. Our purpose is not to contain China, to hold it back, to keep it down. It is to uphold this rules-based order that China is posing a challenge to. Anyone who poses a challenge to that order, we're going to stand up and defend it.
That's the Secretary of State, Tony Blinken. And Walden Bello, I was wondering if you can weave this in. We've been having this discussion about vaccines, and the U.S. really being seen in the eyes of the world right now as more of a danger to the world, especially when compared to Russia and China. Russia and China getting out their own vaccines and facilitating others. The U.S. not doing the same at this point. If you can link that to this also increased tension between China and the United States.
Yes. First of all, I think that, when people look at what the Trump administration did, with respect to blocking the TRIPS waiver, and then contrast that to the way that China was shipping Chinese vaccines, Sinovac, Sinopharm, to countries in the global South, there was a very big contrast there. In fact, these shipments were donations being given. Now, in the case of the Philippines, for instance, the Sinovac, is the only vaccines until about 2 days ago that were available for the general population. Yes, we had the AstraZeneca vaccine from Europe. That had come in, and seniors were vaccinated with it. But the vast majority has been Sinovac, that has come in. So I think in terms of the impact on the global South, there's been that contrast. Now, when it comes to the Philippines, this, sort of donations of the Chinese vaccine has, however, been seen suspiciously by a large part of the population as basically China's effort to buy off the government in terms of the sovereignty rights in the South China Sea, or what we call here the West Philippine Sea. Because the Duterte administration has, in fact, hardly protested, against the moves of China in the West Philippine Sea or the South China Sea around taking, over and infringing on maritime formations that lie within the exclusive economic zone of the Philippines. And so we have the situation within the South China Sea where by a number of the countries here, including the Philippines and Vietnam, feel that they have been really disadvantaged by China's claiming that the whole South China Sea or West Philippine Sea belongs to it alone, 90% of that, whereas all these other 5 other countries border on it. Now, that's a basic injustice. Let me put it that way. That's, really territorial aggrandizement, that's taking place. However, and the China mustn't be doing that. However, you really need to look at it within this broader regional context where China is surrounded by something like in the order of 55 to 60 U.S. military bases coming down from Japan to South Korea to Guam to the Philippines, where they have 5 bases over here. You've got to look at it in the context of the South China Sea. In fact, basically, the 7th Fleet of the United States has deployed itself, and considers that basically a free zone for its ships. And so what we're seeing is that China's perspective or posture has been that of strategic defense. And even the Pentagon admits that China's strategic posture is that of strategic defense, whereas that of the United States is more of an offensive, rapid, forward deployment, And basically what I want to say is this, okay? China's moves in the South China Sea, or the West Philippine Sea, are not justified, they're illegal, but at the same time, they are made in terms of a strategic response to U.S. encirclement and heightened U.S. military activity, okay? And Blinken, that's why we need to look at this, Blinken's statement, it's a warmongering statement. I mean, they came like gangbusters in the Anchorage meeting about 2 months ago, where Blinken
we have 10 seconds, Walden.
Yes, acted so arrogantly towards the Chinese. So I guess my point is this: what Trump's anti-China policy is now also being followed by the administrations of the Biden administration's.
We're going to have to leave it there, but we will continue to explore this issue.